His Excellency Prime Minister Dr. Lotay Tshering, who is an experienced surgeon. Prime Minister Tshering, we are all keen to hear you. Please.
Thank you, Your Excellency. Before I start, I would like to take this opportunity to convey my King's greetings to all the heads of the states and heads of the governments here. As we speak, my King is out of the capital. He is in the district places, ensuring healthcare services, ensuring COVID-19 surveillance system, and trying to motivate our healthcare services and service providers, as well as asking all the people of Bhutan to be on the same page when this pandemic strikes Bhutan. So with this, I also would like to take this opportunity to express my King's greetings and greetings of all of us to Prime Minister Solih for his speedy recovery. And similarly, we also would like to wish Prime Minister Hasina for our father's 100th birthday celebration in few days. So with this, I would like to thank Prime Minister Modi for your excellent leadership to bring all of us together, because togetherness is required at all times. But when the whole world is fighting one common disease that we cannot see with our naked eyes, I think it's very important that all of us come together and leave behind our differences. And number two, I think it is very important that we communicate very clearly on this. Communicate between all the leaders of the world, communicate between central government with local government, communicate with the health planners and the people of the nations. So I think this is very timely, and I would like to thank Prime Minister Modi ji for your excellent leadership on this. To tell my colleagues on the experience of Bhutan on the lone COVID-19 positive that we had, it was the 5th of this month, last 5th of March evening, we had one lone imported case, a Bhutan lover, a Bhutan visitor who wanted to visit Bhutan, came to Bhutan, and then on the 3rd day of his visit, he showed some very abnormal signs, symptoms, and then on suspicion, we found out that he was COVID-19 positive by evening. Yet we wanted to confirm it, and the confirmatory test came just before midnight, around 11:30 p.m. By then, our health officials had all gathered in the ministry. Even my King also came to the ministry, and we all started because we knew that we had the first confirmed positive case. So throughout the night, we worked very hard. Our surveillance system that was already in place was initiated, activated overnight, and starting midnight till 7 a.m. the coming morning, that is 6th of March, we managed to trace the whole path of the first positive case. We managed to identify all the 48 primary contacts. We managed to send all the contact tracers and surveillance team to their respective places and inform them of the importance of house quarantine that first morning. And then as the day unfolded, we managed to pull them out and bring them to the formally identified quarantine facilities. So over 78 hours, we managed to identify all 48 primary contacts from 3 different parts of the country wherever our tourists had visited. And we also managed to initiate the medical team that we had identified to treat in case if he had a positive case. And then he was isolated and treatment started. And it all happened because our health ministry under Minister Dichen's leadership, everything was planned beforehand. And then our King was also awake the whole night trying to coordinate the whole thing and bring all the primary contacts together. So we do not wish to have positive cases in any countries, but to have a positive case in this manner and to be able to identify all the primary contacts and isolate them, I thought was a huge success that we brought in. Then starting from there, we managed to treat him, take care of him very, very well. And his family wanted the patient back home. So he was successfully air evacuated day before yesterday, and he reached his hometown last night actually. So we wish him a speedy recovery. All the people of Bhutan send our sincere prayers for his speedy recovery. But the fact is, since as we all know and as all the heads of the country shared here, this is an uphill task because we really don't see our enemy. This a pandemic that is challenging all of us do not follow geographical boundaries. That's why, as I said, it's very important for all of us to be on the same page. And as we all know that it affects the elderly people and it affects more people with comorbid conditions. So similarly, the aftermath of this disease will also affect the smaller and vulnerable economies more hardly than the better ones. So we are equally concerned that as we fight and as we try to contain this disease, we are also concerned about the economic outcomes of this disease. So therefore, I would like to support all the proposals that were made before me, and also to be very, very sure that we all will share our limited resources that we have, share the technologies that we have, and also to have frequent such meetings so that with the changes in time and with the changes of the demand of this pandemic, we also come and regroup ourselves. And I also would like to propose that we must have a similar cooperation in economic get up on this issue, because all the smaller economies are disproportionately hit. So with this, I'm sure my other colleagues will have a lot of points to share, and I also would like to contribute as the discussion goes on. So as of now, I would like to thank all the heads of the states and heads of the countries and governments, as well as Prime Minister Modi, for your initiative. Thank you very much.
Thank you, Excellency. Now